My name is Joshua. I'm repeating the claim that the Affordable Care Act should be repealed. The affirmative side stated that the Affordable Care Act increases costs for the American people. And a claim I have is that Obamacare gives families a variety of extended coverage. An example would be from Obamacare.com, ObamacareFacts.com says young adults can stay on a parent's plan until age 26, so they don't have to drop their insurance and get their own individually. They can just stay with their mom and dad's. So it's much easier for the kids in going through college to get their insurance. And also another benefit from ObamacareFacts.com, adults with pre-existing conditions such as they have a broken leg or they had surgery, who have been without coverage for at least 6 months, can be eligible for subsidized coverage through the temporary pre-existing condition insurance. So even if they have an illness or a sickness and they're not insured or covered yet, they're still eligible no matter what. They can't be denied when they're covered by Obamacare. Another fact is that, again from ObamacareFacts.com, children under the age of 19 with also pre-existing conditions, they cannot be denied by coverage from most insurers. So even at a young age, you can't be denied if you have certain illnesses under Obamacare. And the affirmative also said that it increases demand for healthcare professionals, even though they're not really there. And although that may be true, Obamacare makes insurance easier for small businesses, therefore creating new jobs, encouraging small business owners to create more businesses, create new jobs. And today, almost half of Americans uninsured are small business owners, or employees or their dependents. And since Obamacare provides small businesses with affordable insurance options and cost assistance via the Shop Exchange, which is a Shop Exchange is it's the guidelines of options you have under Obamacare, which makes it easier for small businesses to choose the best service for their employees and themselves. And it's safe to say that based off that, the small businesses won't be hurt by Obamacare, but in fact they'll be benefiting. Whether or not the healthcare jobs are reduced or not by Obamacare, Obamacare only creates and encourages new jobs and employers due to the fact that they created an insurance system that's easier for small business owners to follow and create their own businesses. And the affirmative claimed that the law infringes on people's liberties and forcing them to pay insurance when they don't need to or want to. The document was passed by the majority vote of Congress, and the senators that were they were elected by the people. They represent the people. So stating that it did infringe, it may have infringed on the liberty, but they were being represented accordingly because they did vote on their senators, and that's how it was. And then Councilman Mora stated that repealing the Affordable Care Act it's a terrible idea. It's a terrible idea. If you're uninsured, it will still be your choice to buy insurance. But if you can't afford insurance and choose not to purchase it, other taxpayers will no longer subsidize your care for free. So you can choose not to buy insurance, but if you can afford it, you're not going to be subsidized anymore. And in a court case with Chief Justice Roberts, the federal government does not have the power to order people to buy health insurance. That's true. But the federal government does have the power to impose a tax on those without health insurance. And they also say that the Affordable Care Act directly increases premiums. From an article from Percha, written by Julie Percha on health insurance rebates, a medical loss ratio, or the 80-20 provision, was created, which meant that businesses have to spend 80% on care. If they don't, 80% of their profits are supposed to be spent on healthcare, and if not, if it's under 80%, then they have to give their employees a rebate. If insurers spend too much on overhead, things such as salaries or bonuses, as opposed to healthcare, which I just stated, they have to issue premium rebates. They give money back to the people that were paying for the insurance. If the company doesn't pay focused enough payments on the insurance more, but they pay more on salaries and such. And again, from Health Insurance Rebates by Julie Pritchett. Last year, August 1st, 2012, about 12.8 million Americans received a premium rebate, according to the Department of Health and Human Services. And the average privately insured family will received at least $150 in rebates from the provision. And about 31% of Americans who have individual insurance are eligible for a rebate. They get their checks directly in the mail, averaging about $127, according to the study by Kaiser Family Foundation. For people who buy insurance through their employers, those rebates are still given, but they're not given directly in the mail. It's up to the employer. The employer can either send out the individual check to their employees or put the rebates toward lowering future premium costs. And my affirmative stated that people wanted to put off buying health insurance until they actually needed it. That's true because people don't understand Obamacare. They're ignorant of Obamacare. The Affordable Care Act would provide subsidies to those who can afford it. But again, most citizens are either unaware of that fact, don't know if they're eligible, or are completely confused on how to apply in the first place. And they stated that the act should be repealed, but so far, the Republican Party has tried coming 37 times and have failed. So the process would be timely, and it's already showing that it's not gonna pass.